Dr. Pearl Grimes, and I am clinical professor of dermatology at UCLA in the Department of Dermatology. I am also director of the Vitiligo and Pigmentation Institute of Southern California. I love pigmentary disorders. It's what I've done for at least 30 years. So, what are the pearls that I've talked about in my lecture? Certainly, I think that one key take-home message is having you understand the devastation of pigmentary disorders, the devastation of vitiligo, which I think robs a patient of their dignity. And while melasma may not be quite as devastating, patients are overwhelmed by this disorder as well. I think that we're making really exciting advances in understanding the pathogenesis of vitiligo. We now know that this is a disease that is due to a complex interplay between genetics, oxidative stress, and autoimmunity. We know what some of the key players are now in driving melanocyte destruction. Key pathways now involve gamma interferon, cytotoxic T lymphocytes, and we think that CXCL10 is the chemokine that is driving the process of depigmentation. Given that new science, I think that the future is bright. I think that we will eventually have new FDA-approved drugs given our new insights regarding the science of vitiligo. There's enormous interest now in looking at the JAK inhibitors, simvastatin that we use to lower cholesterol, which impacts the immune responses that we see in vitiligo. So, again, the future is bright. So, you know, despite the fact that we still rely on hydroquinone, and it's been around 50 years, it's still our #1 therapeutic modality. I think that's going to change within the next couple of years because, again, there are multiple new studies, multiple companies interested in finding new drugs for melasma. I think one of the things we've come to realize, given the science of melasma, is that the skin is much more fragile than we have ever thought. The barrier is abnormal. So I think that if I leave my compatriots with any message, it would be that less is probably more when we look at how we approach melasma. Our evidence-based studies suggest that we still get our best results with triple combination bleaching, and that when we use the synergistic modalities, peels, lasers, microdermabrasion, we still have to use them with care and caution because our workhorses really are sunscreens and our topical agents. And of the sunscreens, we now know that there is a role for sunscreens that protect against visible light, such as iron oxide, and there are even infrared sunscreens now. So, and the other issue is if a patient is in front of a computer constantly, they need to use sun protection, albeit they're not outside, because computers can emit visible and infrared light. So, I think to conclude for both of these disorders, I'm so excited. The future is bright.